I've been twice.
Okay.
I did it twice, but really it's very difficult for me. It's a little bit hard. I scared from it.
Okay.
That's why when they send for me, sometimes I can't go.
There are 3 national screening programmes. There's breast screening programme, cervical screening programme and bowel screening, which is men and women. So just going to start off by asking you some fairly general questions about smear tests. So
Okay.
I gather that you've had them done before,
Yeah,
have you?
yeah.
Can you remember when your last one was?
My last one was about 2 years ago now.
Okay,
Yes.
and was it normal? Was there a problem with it?
No, there
Can you
was no
remember?
problem at all, and that was the second smear. The first
Okay.
one was when I was 60,
Okay.
and my GP wrote to me, and I went for the smear. She did it in her surgery.
Okay.
You know.
One of our main concerns in Westminster is the uptake and coverage, which are 2 slightly different things, but in a nutshell, we really are aiming towards an 80%. 80% of women being screened for cervical cancer. That's what makes the screening programme worth doing in terms of lives saved. Breast cancer, the target figure is slightly lower. That's at 70%. We are underachieving significantly on both those targets in Westminster for a whole variety of reasons.
I think it's very off-putting for, for women to have to go and actually make a hospital appointment. It's a bit daunting, really, to actually go into a hospital setting, and you might be sitting next to somebody who's already had a mastectomy. It's quite, nerve-wracking.
If the women don't feel that the service is sensitive to their needs and safe enough, they don't always come back. I don't get to hear about them, or they sometimes delay it for years because they feel very anxious and frightened about coming back again.
I didn't know exactly what that meant, and then it asked me to sit in the couch, and she asked me to open my leg, and it was, for me, it's a very horrible experience, and I didn't finish, and I just ran away.
We've got women coming in from countries where screening is not available.
In our countries or African countries, we don't have this test for breast or everything about cancer. And when they found the cancer, they found too late.
Well, because they don't believe in screening, because of their religion, they don't believe in exposing their body to a third party apart from their husband.
In terms of deprivation, ethnicity, health inequalities, the picture is quite interesting with screening because we know that the usual reasons, the deprivation and ethnicity and poverty, those reasons do apply. Women don't understand the screening service as well, they don't understand the literature that we send them, they don't understand the purpose, the benefits of the screening, and I think that we have a whole range of challenges across our populations. So we have a whole range of different reasons why women aren't coming in, and we need to be thinking about a whole range of ways that we approach dealing with that. They were cold, weren't they? So we now use plastic ones, and that's what goes inside your vagina there.
That's it.
And then that's what I need to open up
Yeah.
to actually find your cervix.
Mm-hmm.
That's your cervix there at
Yes.
the top of your vagina. And then this is the brush I use, or
To
one
scrape
like it,
and there's something out there.
to scrape. Scrape sounds quite painful.
Mm-hmm.
Have they been painful in the past? So really for public health, our role is about promoting the message.
Well, we have a nurse who works with us, There's a White, who is part of the health improvement team of Westminster PCT. And her role is to offer people a health and well-being check. So she does a basic clinical baseline, which she takes the results, she talks through the results with them, and she also sends them to the GP. But the really important thing that she does is firstly, she checks that they actually have a GP in the first place, because if you don't have a GP, you miss out on all the screening opportunities. That won't be covered. And then secondly, she actually talks through what the screening programs are. She can demystify them. She can describe briefly some of the procedures so that she can tell, so that people aren't frightened of what's actually going to happen to them. She can talk about the things that may happen after the screening has been done, the kind of treatments that are available now, and how different it is if you find something early rather than later. And she also may help people to, in terms of how they actually talk to their GP and how they ask questions, because that was one of the things that we found running this program. So a lot of people don't quite know how to approach their GP, so they go and see them and come out feeling frustrated and not having got the information that they actually wanted. So that's quite an important role in terms of saying how screening is a normal process and is for everybody.
And it's actually raising that status, really from poor relation, to something that trips off people's tongues naturally whenever they meet people who are not just in that screening age group, but bearing in mind that children talk to parents and that grandparents talk to children, and actually the messages can come from quite a wide variety of sources.
So as part of the community pharmacy contract, pharmacists are required to participate in up to 6 public health campaigns every year. And what we did in a previous year was we actually focused on bowel cancer and promoting bowel screening to patients and members of the public that were using pharmacies.
So, in terms of cancer screening, we work with women and also with men to raise awareness about breast screening and cervical screening.
One of the initiatives that the Health Inequalities team is involved in that can help with cancer screening is our health trainer programme. As part of that programme, what we do is we train up local residents and give them some skills to work in the community around health. Perhaps they might be out on a healthy walk with people with a walk leader, and they can just be going around with people talking about the benefits of being screened, maybe a little bit about what people might expect when they access a service, and just generally taking some of the fear out of that.
Okay, we're able to provide you with details of where your nearest clinics are. We're also able to provide you with information, telephone numbers, and whether we have particular community screening programs going on at the moment. We can also, I know we had problems with people asking for the kits for bowel cancer, and we was able to provide them with information about that.
I think once women get it into their heads that there are benefits that they feel they could benefit from, so it has to be something they personally feel susceptible to. So there are benefits for them, and that they can actually get to the service relatively easily, that they don't have to trek halfway across London at an inconvenient time, or get time off work. If the service, as I said before, is safe enough, if it feels safe and it feels sensitive enough and respectful enough, most women will actually come.
I think we need more session to let them, be more knowledge and more, confident to do that thing.
Their GP should always write to them to tell them to come, or call them at the surgery to explain to them what is it all about.
I'm going to do it anyway. Yeah, I'm going to push myself to do it because I know and I believe it's very important.